السلام عليكم ورحمة الله. أنا دكتور علي صبح، أستاذ مساعد طب الأطفال، أمراض المعدية ونقص المناعة. إن شاء الله النهاردة هنتكلم معاكم عن موضوع مهم جدا وهو Will Child Visit. يعني هو مهم جدا، لا يقل أهمية عن Sick Child Visit، له أهداف كتير جدا. في المحاضرة النهاردة هنتكلم عن Importance of Will Child Visits to know the US Preventive Service Task Force، وده هدفه حماية الأطفال ومتابعة نموهم الطبيعي، and the American Academy of Pediatrics Guidelines for Screening and Recommendations for Infants and Young Children, to recognize also the most useful assessment of tools applied during Will Child Visit according to evidence-based medicine. الفيزيت دي هنتكلم فيها عن الأطفال من سن since birth لحد سن 5 سنين تقريبا. من هدفها provide opportunities for physicians to screen for medical problems and anticipatory guidance. We promote good health, allow the family physician to establish a relationship with the parents or caregivers، وده شيء مهم جدا. الهيستوري زي أي حاجة في الطب، هو أساس الدياجنوزيس وأساس التعرف على المشاكل الصحية. فبناخد brief review of birth history من أول الحمل حتى الولادة وما بعدها. Prematurity can be associated with complex medical conditions. Evaluate breastfed infants for any feeding problems. Also assess formula-fed infants for type and quantity of iron-fortified formula being given. For children eating solid food, feeding history should include everything that child eats and drinks: sleep, urination, defecation, nutrition, dental care, and child safety should be reviewed. Medical, surgical, family, and social history should be reviewed and updated. For newborn, also review the results of all newborn screening tests and schedule follow-up visit if necessary. This is an example of newborn screening. Newborn screening programs usually differ from country to another according to available resources, according to most common genetic disorders that should be screened, like congenital heart defect, genetic and metabolic disorders, hearing impairment, hyperbilirubinemia. In Egypt now, the screening program usually started with thyroid screening, then some metabolic disorders like phenylketonuria, then hearing assessment, and now to many metabolic disorders, but this screening is limited for sick newborn admitted to NICU. After history, we will go through examination, head-to-toe examination. Interval growth should be reviewed by according to age and sex. وجروث تشارت من الحاجات المهمة، وأعتقد إن احنا درسناها في السمستر 7 و 8. Weight for age, height, head circumference, weight for height, body mass index, and there are specialized charts for very low birth weight, preterm, and special conditions. There are some examples for the growth chart, starting from birth till 36 months old, length and weight for age. Girls are red, boys are blue. This is for head circumference and weight for length. The same for girls, boys 2 years till 20 years. So we have growth chart starting from birth to 36 months or 3 years. The children during the period from 2 to 3 years, it's better to use the first one, which is birth to 36 month old growth chart. This is what happened in the screening test. When we have abnormal screening test, we confirm the diagnosis by more laboratory techniques to establish the diagnosis, because there are some false positive and false negative results. Some maternal problems are very important to screen after birth, like maternal depression. Prevalence of postpartum depression 12%. American Academy of Pediatrics recommend screening mother at 1, 2, 4, and 6 month while child visits with further evaluation for positive results. The prevalence of mental health disorders like anxiety, depression, behavior disorders, attention deficit, hyperactivity disorders in preschool age children is around 6%, which is quite high. Risk factor for these disorders: having a low socioeconomic status, being a member of ethnic minority. Also, development and surveillance. American Academy of Pediatrics recommend early identification of developmental delay and autism. Insufficient evidence to recommend formal developmental screening or autism-specific screening if the parent, caregivers, or the doctor have any concern. Any area of concern should be evaluated with a formal developmental screening tool. The American Academy of Pediatrics recommend competing the mentioned formal screening tool at 9, 18, and 30-month well child visits. The American Academy of Pediatrics also recommend autism-specific screening at 18 and 24-month with modified checklist for autism in toddlers. Iron deficiency is a very common problem, especially in poor and less developed countries. It's essential to ensure adequate iron intake. Based on expert opinion, the American Academy of Pediatrics recommends supplements for preterm infants beginning at 1 month of age and exclusively breastfed term infants at 4 months of age. Based on expert opinion, the American Academy of Pediatrics recommend measuring child hemoglobin level at 12 months. Every child should be screened for anemia at age of 1 year. This is very important. Lead poisoning also, or lead, which cause anemia. Elevated lead blood level are prevalent in young children. Targeted screening approach between 6 months and 6 years in high risk. And actually, this is not common in Egypt, so it's usually done in some countries like USA. And it's not recommended for screening for lead poisoning in children at average risk who are asymptomatic. Vision screening at least once recommended to detect amblyopia between 3 and 5 years of age. Testing options include visual acuity, photo screening, and autorefractors. American Academy of Pediatrics recommended the use of an instrument-based screening like photo screening or autorefractors between 12 months and 3 years of age, and annual visual acuity screening beginning at 4 years of age. Immunization. The American Academy of Family Physicians recommend that all children should or must be immunized. Immunizations are usually administered at 2, 4, 6, 12, 15 to 18 month will child visit, the 4 to 6 year will child visit, and annually during influenza season. Additional vaccination may be necessary based on medical history. And then the anticipatory guidance for safety, dental care, screen time, sleep, diet, and activity. Safety. Injuries remain the leading cause of death among children. Appropriate use of child restraints. Infants need a rear-facing car safety seat until 2 years of age or until they reach the height or weight limit for the specific car seat. Children should then switch to a forward-facing car seat for as long as the seats allows, usually 30 to 36 kg. Younger children should wear bicycle helmets. Having functioning smoke detectors and an escape plan decrease the risk of fire and smoke-related death. Water heaters should be set to a maximum of 120 Fahrenheit or 49 degrees centigrade to prevent burn. Infants should not be left alone or on any high surface, and stairs should be secured by gates. Infants walkers should be discouraged because they provide no benefit and increase fall down stairs and fracture. Infants should never have a bottle in bed, and babies should be weaned to a cup by 12 months of age. This is very important because it's one of the most common causes of dental caries. Juice should be avoided in infants younger than 12 months. Fluoride use inhibit tooth demineralization and bacterial enzymes and also enhance remineralization. The American Academy of Pediatrics and the U.S. Preventive Task Force recommend fluoride supplementation and the application of fluoride varnish for teeth if the water supply is insufficient. Begin brushing teeth at tooth eruption with parents or caregivers supervising brushing until mastery. Children should visit a dentist regularly, and an assessment of dental health should occur at well-child visits. Screen time, the very important topic nowadays. Hands-on exploration of their environment is essential to development in children younger than 2 years. Video chatting is accepted for children younger than 18 months, otherwise digital media should be avoided. Parents and caregivers may use educational programs and applications with the children 18 to 24 months of age. The American Academy of Pediatrics recommends a maximum of 1 hour per day that occur at least 1 hour before bedtime. Longer usage can cause sleep problems and increase the risk of obesity and social emotional delays. The American Academy of Family Physicians and Pediatrics recommend that children participate in at least 60 minutes of activity play per day. To decrease the risk of sudden infant death, the American Academy of Pediatrics recommended that infants sleep on their back on a firm mattress for the first year of life with no blankets or other soft objects in the crib. Breastfeeding, pacifier use, and room sharing without bed sharing protect against sudden infant death syndrome. Infant exposure to tobacco, alcohol, drugs, and sleeping in bed with parents or caregiver increase the risk of sudden infant death. It's recommended that breastfeeding should continue until at least 6 months of age and ideally for the first 12 months. Vitamin D 400 international supplementation for the first year of life in exclusively breastfed infant is recommended to prevent vitamin D deficiency and rickets. Early transition to solid food before 6 months is associated with higher consumption of fatty and sugary foods and an increased risk of atopic disease. The American Academy of Family Physicians and Pediatrics recommend that children participate in at least 60 minutes of active free play per day. Delayed in transition to cow milk until 12 months of age decrease the incidence of iron deficiency. Introduction of highly allergenic foods such as peanut-based food and eggs before 1 year decrease the likelihood that child will develop food allergy. This is very important. 17% of children are obese. The U.S. Task Force does not have recommendation for screening or intervention to prevent obesity in children younger than 6 years. Cessation of breastfeeding before 6 months and reduction of solid food before 6 months are associated with child obesity and not recommended. Drinking juice should be avoided before 1 year of age, and if given to older children, only 100% fruit juice should be provided in limited quantities, 4 ounces per day from 1 to 3 years of age and 4 to 6 per day from 4 to 6 years of age. Intake of other sugar sweetened beverage should be discouraged to help prevent obesity. Always do a head-to examination. Assess for psychosocial because it's usually missed. Stick to recommendations in diet to avoid increasing incidence of obesity. Stress on dental care. Advise families to avoid smartphones and media devices. Thank you.